Hello everyone, welcome to Insight. I'm your host John Maora and I trust you had a nice week. Now, nearly 2/3 of Nairobians live in the slums, but do you know how good or bad the situation is in the slums? Now, tonight I'm talking to Dr. Caroline Kabiru, or a research scientist with African Population and Health Research Center, who's going to tell us how good or bad the situation is there in the slums. Welcome, Dr.
Thank you very much, John.
Yes. Before we get to the questions, I would want to understand, what does your organization do?
Okay.
And how often do we get surveys? Because I understand the recent one, you did it in 2012. You could tell us why it took so long for the findings to come out.
Okay. As you mentioned, my name is Caroline, and I work with the African Population and Health Research Center, which is an international non-governmental research institute that's based in Nairobi.
Yes.
And we conduct research in the areas of health, education, population, development in Africa, in addition to other things, including policy engagement and communication and research capacity strengthening. In terms of the survey, this was the second one that we're conducting. The first one was conducted in 2000, which is just around the time that the MDGs were set up. And now more than 10 years later, a decade later, we wanted to take stock. What changes have happened in the slums since the first survey, in terms of health and population.
And we would want to understand how dire is the sanitation issue in the slum? Because I understand this was one of the areas that you concentrated on in the survey.
Well, sanitation emerged as an area of concern for people in the slums. We asked people who live there, what are some of the key concerns that you face in your daily life? And sanitation, whether in terms of drainage, whether it's in terms of water access, because water and sanitation go hand in hand.
Yes.
Those were some of the key issues that emerged. Almost 2 out of every 5 people in the slums is concerned about these issues. Yeah.
Let's dwell much on sanitation. Is flying toilets and pit latrines, finding their way out in the slums nowadays, or the situation is the same?
In terms of access to sanitation, we asked people the types of toilets that they use, and the proportion that say that they have no facilities is actually very small. Most people have access, whether it's to a pit latrine or to flush toilets, and actually 46% of people in the slums say that they have access to a flush toilet. But again, it's not that it's in their home. It might be shared. Many of them are living in compounds where there are several families, and then they're all sharing the toilet. So in terms of sanitation, one can definitely say there's been an improvement in access to whether it's toilet facilities in the slums. Yes. So in terms of your question, are flying toilets a phenomenon? I hope they are a dying phenomenon in the slums. Yes.
Does the slum community feel disturbed that there's not so much water in the slums, whereas so many people in Nairobi live in the slums? Do they feel that this is one of the most basic needs that they should have?
Yes, in terms of the key concerns, access to water was raised by at least 1 in 5 of every person that we interviewed for this survey. So yes, it is a concern. And if you look at where they're getting their water, most of them are using public taps. Very few of them have access to piped water, as in the rest of Nairobi, where many people have the water directly piped into their homes. But in the slums, it's not a similar situation. But in terms of access, so for example, in 2000 we asked them, where do you get your water from? And a huge proportion of them were actually buying water. Now you go and ask them, and 60% are actually getting it from piped public taps.
Yes.
So in terms of improvement, again, an area of improvement, but it remains an area of concern. And of course, when we see the changes that are happening, more people are saying that they have flush toilets. Flush toilets need water, so of course their need for water will naturally increase.
When we talk of public taps and the issues of sanitation, some of these taps are not well manned, like you have tapped water in the house. So did they raise any concerns with the tapped water, the public tapped water?
We did not ask questions about concerns about the quality of the water. We asked about access to water, and as I said, 60% say they have access through the public taps. And I think it's really a reflection of investments that have been made by local government to make sure that the taps, at least people in the slums, have access to water. Maybe not directly into their homes, but at a public point.
So how dire? You said that about five people were raising an issue. Well, no, 4 out of 5 were raising an issue of water. But how serious is the water problem in the slum?
That's, I think for those who have visited slums, of course, not having water in your home in the quantity that you need is a problem. But I don't think we should take away from the fact that they do have some access, and it does meet their needs. Some of the bigger issues that they have raised include issues of drainages, which are huge. If you visit the slums, most of the time you'll see a lot of open drainages, and so it's not surprising that they will raise that as an issue. But of course, people need water every day, and so it is a concern when you don't have the amount of water that you need.
I've been to the slums several times, and I see that even those public taps, you have to buy water from those taps in order for you to get water from those taps. Did the issue of how much they have to pay for water come up in the survey?
We did not ask about payments for water, so I'm unfortunately not able to answer that question.
Okay. Still sticking on sanitation and water, because you see, sanitation and water come hand in hand. But in the slum areas, where do the two meet? Because you find even the streets there, even the alleys there, they're not as clean as you'd expect them to be. So where's the connection between water and sanitation in the slums?
I think anywhere, not just in the slums, water and sanitation go hand in hand. To be sanitary, you need water. When we're talking about issues of, for example, the toilet facilities, you need water. If people need to wash their hands, you need water. So the two go hand in hand. The minute people have access to water, then you have to dispose of it. And so sanitation systems, drainage systems all come hand in hand. So they're all part and parcel. So we talk about water and sanitation and hygiene, all of them going together.
And when there's no sanitation, obviously, we are going to have some diseases and infections.
Yes.
How bad is the situation now in the slums, as far as health is concerned?
Okay. We asked people in the households about diarrhea among children under the age of 3 in the 2 weeks preceding. So did you have any child who had diarrhea in the 2 weeks that preceded our survey? And in 2000, when we asked the same question, we had almost 1 in 3 reporting that yes, there was a child. Now it was 1 in 2. It was 1 in 5. So clearly there's a reduction from 30% to 20%. And again, for us, there's a clear link between the improvements that we're seeing in terms of sanitation, access to water, improvements in access to toilet facilities, etc., and the reduction in the proportion of people who are reporting diarrhea in the household. So yes, the two are, we think, linked. At least the literature, even not just in our work, in previous literature, will show a strong link between access to water and sanitation facilities and disease. So yes.
How about access to health facilities? How easy is it for a slum resident to get access to a health facility?
When we asked the question, I believe about 12% of people raised issues of access to healthcare as an issue. And yes, we have a demographic surveillance site in the slums, Korogosho and Viwandani. And in those two sites, you see a near absence of public health facilities. But it doesn't mean that there are no health facilities. If there's a need, it will be filled somehow. Demand will lead to creation or supply. And you do see that there are a lot of private providers who are providing health services in the slums, but then you come into issues of quality because again, these are private facilities, some of them may be unregulated, so it is an area of concern. Yes.
And also the issues of access. Yes, it's possible to access the health center, but can you really secure medication or treatment from these health centers? Because again, the issues of cost have to come up. How are these related in as far as access and cost? of health services in the slums?
Again, as I mentioned, there'll be a lot of private facilities in the slums that are providing services, healthcare services, including medication. And it might be a chemist, for example, that's providing health medication for the community. For me, I would still go back to the issue of quality, because many of these are private providers, remember? Issues of regulation may not be there. The issues of are the medicines authentic might be issues, but again, it is an area of concern. People have said it. Quite a number of people in the slums have raised that as an area of concern.
Does this also include pregnant mothers and young children? Because you find that when health facilities are not so easily available, then many mothers give birth at home, and that raises the risk of them either dying during delivery or the child dying during delivery. So did such issues come up in your survey, and how dire or needy are they in the slums?
We actually asked women about where they have delivered their children. And since 2000, when we conducted the first survey, we see a significant improvement in the number of women who are actually giving birth in health facilities, which is a good thing. And that could be tied to, we also see a huge decrease in child mortality. So again, since 2000, there's been so much investments into improving the lives of people in the slums. And it's not just by government, it's development partners, it's NGOs. So it's not surprising that we're seeing these changes. But issues of access will still remain something that we have to pay attention to. The number of people who are living in slums is continuing to grow. So it will still be something that we have to invest in. But in terms of, with respect to your questions, yes, there are a lot of women actually deliver in health facilities. And we see a marked reduction in child mortality.
Those that don't, because again, there are those that don't deliver in health facilities, is this because they don't want to, or is it because the health facilities do not exist at all for them to go?
Okay, I can't answer this from this particular survey, but we have conducted several studies on maternal and child health in the slums. And for some women, access is an issue. And when you have a choice between paying for something you really can't afford, or it's too far, or you're a bit concerned about the quality of care that you will receive, you will prefer to give birth at home. But one thing that we did note, and this was reported in a paper published in 2009, is that actually a lot of women in the slums will be strict about attending antenatal care because they know they might not deliver in the hospital. So they want to make sure that their pregnancy is fine, and then they can deliver at home. Of course, the best case scenario is that you deliver in a health facility, if that's really where you'll get the best care.
Still on sanitation, how does the housing system in slums complicate the issue of sanitation?
The informal nature of slums means that a lot of things will be put together haphazardly. So you come today, there's a house here where there wasn't. And of course we know that providing infrastructure really requires a regulated system.
Yes.
And so if that is lacking, then it's difficult to provide the services, whether it's water and sanitation, whether it's electricity, whether it's anything. It just makes it a lot more difficult.
Did the research give a prediction of how much the situation will have improved or gotten worse in the slums as far as sanitation is concerned in the next, let's say, 3 or 4 or 5 years? And how dire will that be?
For this particular survey, we were really reporting on the status as is. So there were no projections. But if we were to go by what we've seen between 2000 and 2012, then we can say, yes, it's positive. It has been a positive change, and we hope that that will be sustained. And I think the governments, the non-governmental organization, development partners are all keen to improve the lives of people living in slums.
It's a whole 12 years since you've done the last research. Do you think that this should have come sooner, or do you think that it's timely, or do you have any regrets about doing this research 12 years after the first one?
I don't know. I think it is timely because if you look at where we were at 2000, for example, you had the MDG that focus specifically, I think that was target 7D, on improving the lives of 100 million slum dwellers. And the MDGs come to an end in 2015.
Yes.
So we're still within that period. Have we seen change? Of course, there are issues with that particular MDG because it talks about 100 million slum dwellers, but there's a lot more than that. It's only a small fraction. But again, it's because of the estimates that we had at the time, and now we have more refined estimates of the actual number of people living in slums. And we know it was an underestimate.
How about education in the slums? What was it lacking? Is it the infrastructure or the teaching profession, professionals, or what is the missing link, or what is the missing aspect in education in the slum areas?
In terms of, I'll answer the question in terms of school participation. When we asked about the proportion of people who are in school, and these are young people, so from 12 all the way to 24, we see a dramatic increase in the number of young people who are in school. If we're talking about 12 to 14-year-olds, over 90% of them are in school. And that is a huge increase from what it was in 2000. And again, we think the investments in free primary education by the government had a huge role to play in that. But even when we're saying that, some of our previous research, so not necessarily the Nairobi cross-sectional slum surveys, actually points to issues of quality in schools. A lot of young people in the slums are not necessarily in public schools, they're in informal schools where issues of quality are an issue. So in terms of education, I would say greater access, but we have to pay attention to quality.
Okay, let's come down to security, which is almost a mainstay in many slum areas. Did you research maybe happen to pinpoint some of the most common forms of crime in slum areas, and which are they?
We asked a question on insecurity. So to what extent is insecurity a concern for people? And if I remember correctly, that was 12.5% of people who said that security was a concern. And that's in 2012 compared to about 8% in 2000. So clearly, insecurity is becoming an issue of concern. And it's not just based on this particular survey. Although we did not ask people specifically what kinds of insecurity are you talking about, our previous work, for example, will show that issues of gender-based violence are a concern, issues of rape, issues of other crimes, robbery, are a key concern. And that's based on other research that the African Population and Health Research Center has conducted.
Okay. Well, given health, sanitation, water and security, which one stands out as the most need for people in the slum areas?
Based on their perceptions, in terms of when we asked what are the important problems that you face, issues of water and sanitation came up as tops, but issues of health and issues of insecurity were just as important as well. But the top were related to, if we're going by proportion who mentioned them, then it would be water and sanitation. But of course, life in the slums is not easy. And of course, you have very many problems, and maybe they pick the most pressing at that point. But it doesn't make the others any less significant.
Did the report make any recommendations on how to improve water and sanitation issues in the slum?
In terms of policy and programmatic recommendations, what we have said is that continued investments in these areas is important. I think we have to take cognizance of the improvements that happened between 2000 and 2012 when we went to the slums. When you're seeing more people accessing water from public taps, it means that someone is doing something right. And those investments need to be sustained. We shouldn't stay back and say, look, we've made improvements, that's it. No, it's not, because issues of access to water should be universal. Everyone deserves them. It's their right. And so until we have universal access, we cannot stop.
How about issues of lighting? And these are more or less connected to security. Are a good number of Nairobi slums well lit at night? And where does this source of power come from?
We did ask households whether they have access to electricity, and about 1 in 5 households, if I'm not wrong, mentioned that they have access to electricity. So of course it's not universal again. But of course, I cannot comment on that since we didn't particularly ask whether there's a connection between light and security. But we know for a fact that if you have light, lit areas, less crime, and so ways to improve lighting in slums is critical. And we have seen the government do some of those in terms of the floodlights that are in some of the slum areas. And yes.
The few numbers, you might not have asked this, but maybe it's good because you observed, you were there, you saw it. The small number that said they had electricity in their house, is it from the right source or is it an illegal connection? And how rampant is that in the slum areas?
Unfortunately, I'm not able to comment on that based on the research, but anecdotally, yes, we do know that there are a lot of illegal connections.
Yeah, Caroline, you'd appreciate that Nairobi has a big population living in the slums. Going by what you found in the research, how bad is it if someone sought to come from the village and wants to come and live in one of Nairobi's slums? How bad is the situation there? And how best would they do to avoid such a scenario?
Okay. I think one issue that we need to be clear about is that slums do have a role for many people. It grants you greater access to the benefits of living in a city, and we do know that cities are advantageous in terms of access to employment, in terms of amenities, access to schooling. So it would be very hard to tell someone who is living in some remote area in the rural areas, don't go to the city because you live in the slum. When, I mean, people make rational choices. And even when you look at slums, it's not that it's all dire. There are many people who live in slums and are doing well. But as whether we are research staffs or whether we are the government, whether it's development partners, I think everyone deserves a basic life that's of quality. And we know that in the slums that may not always be met. And we have an obligation to make sure that every person is living a healthy life, has access to water, has access to good quality education, because these things are enshrined in our constitution.
When you're doing the survey, did you happen to know who between children and the grown-ups suffers most from poor in sanitation and lack of water?
The questions we asked in terms of health were primarily geared towards children under 3, more vulnerable in terms of issues of diarrhea. And like I said, even in that age group, you're seeing an improvement in health. And we're linking that to improvements in sanitations that we're seeing. So like I said, in 2000, when we asked the question, how many children have had diarrhea in the past 2 weeks, 30% of households said that there was a child who did so. But when we asked the same question in 2012, it was 20%. So that's a 10 percentage point reduction. So in terms of improvements, it's there.
Do you get to know the quality of toilets that they're using, or the pit latrines that they're using? Because you could be having a pit latrine less, but it is overflowing with waste. So it's of no importance having it. You had better use other means of relieving yourself than using the same facility.
Yeah. For us, we actually were asking about the type of toilet facilities. So in terms of direct observation, was this clean? Was it not? We can't answer that question. Yeah.
Let's come to challenges that you faced when doing this research, because I presume there were some, and if not some, there were many. So what are some of the challenges that you came across when you were compiling this report?
In terms of the actual data collection, it's a huge task to actually implement such a huge project where you're interviewing a large number of people in different households, making sure that you get people and interview them. The questionnaire is long. There's, of course, respondent fatigue, but these are natural in any research project. And I think other than that, I don't think there was anything so major that was unlike any other survey that we've conducted. So the normal challenges that one faces.
I presume one challenge was about trust, because Kenyans have a lot of trust issues. This happens even during the national population census. We find that someone is coming to your door to knock, asking you how many are you in your family or what have you, and then people even tend to lie because they don't know who is asking them these questions. Did you come across these issues?
In terms of research practice, you do have to be careful because of, again, issues of trust and making sure that people are aware of what they're being asked to do, making sure that you explain to them that the answers that they give are really for research purposes. We're not going to say so and so said this. We're going to aggregate data so that we'll report on, for example, males. We won't say this particular male. So it's all about how you explain your research to the people, make sure that they understand that it's voluntary, they can say no, and we actually, in computing whether our sample is representative, we actually look at numbers of how many people refused. You went to their house, and they have a right to say no. And even when you're conducting the interview and you've reached question 20 of 200, they can still say, I don't want to do this, and it's fine. And for us, we actually have to explain that. It's your right to do that. Again, but it all boils down to explaining to people that you're doing this for research, it's for the greater good of society, and that you have the right to say yes or no.
Do you have any other research that are coming up soon on issues to the slum?
We actually have a demographic surveillance system in the slums, so we are constantly in the slums, Korogosho and Viwandani, and we have a lot of studies that are nested on that system. So what the system does is that we know the population that's living in a certain defined area. We know the key demographic and health indicators, for example, how many people have died, how many have been born, who moved out, who moved in, and we're able to nest a lot of other studies on it. So there are several studies that are ongoing, and people can always visit our website to get more information.
Okay, all the best in your service. Thank you for coming to our show. And thank you, viewer, for keeping it GBS TV. This has been Insight coming to you on GBS TV. I have been your host, John Maura. Good night.